Pseudoephedrine is used to relieve stuffy nose and sinus pain/pressure caused by infection or other breathing illnesses. This includes the common cold, flu, hay fever, allergies, and bronchitis. It works by narrowing the blood vessels to decrease swelling and congestion. If you are using this medication, make sure to read the instructions carefully and consult your doctor or pharmacist if needed. It's important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years old. Long-acting tablets/capsules are not recommended for use in children younger than 12 years old. Always follow the recommended dosage and do not use this product to make a child sleepy. Be cautious about giving other cough and cold medication that might contain the same or similar decongestants. Ask your doctor or pharmacist for other ways to relieve cough and cold symptoms. When taking Sudafed, be sure to read all the directions on the product package before taking the medication. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food, usually every 4 to 6 hours, as directed by the product package or by your doctor. Do not take more than 4 doses in a day. Dosage is based on your age, medical condition, and response to treatment. Do not increase your dose or take this drug more often than directed. If you are using the chewable tablets, chew each tablet well and swallow. If you are using the liquid form of this medication, measure the dose carefully using a special measuring device/cup. Do not use a household spoon because you may not get the correct dose. Be sure to check your product package for specific directions, as there are many brands and forms of pseudoephedrine available, and the dosing instructions may vary between products. Also, be cautious with caffeine intake, as it can increase the side effects of this medication. If your symptoms do not improve after 7 days, if they worsen or return, if you develop a headache that doesn't go away, fever, or rash, or if you think you may have a serious medical problem, get medical help right away. Some common side effects of Sudafed include nausea, vomiting, trouble sleeping, dizziness, headache, or nervousness. If these effects persist or worsen, it's important to inform your doctor or pharmacist. It's also important to stop taking Sudafed and contact your doctor if you experience dizziness, nervousness, or trouble sleeping. However, many people using Sudafed do not experience serious side effects. If your doctor has prescribed this medication, they have likely determined that the benefit to you outweighs the risk of side effects. It's important to seek immediate medical attention if you experience any serious side effects, such as fast/irregular/pounding heartbeat, mental/mood changes, shaking, or difficulty urinating. While rare, a very serious allergic reaction to Sudafed can occur. Seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Sudafed, it's important to talk to your doctor or pharmacist if you have any allergies or have had negative reactions to similar medications in the past. If you have certain health problems such as diabetes, heart issues, high blood pressure, kidney disease, or difficulty urinating, it's important to consult with a healthcare professional before using Sudafed. This medication can cause dizziness, especially when combined with alcohol or marijuana. It's important to avoid activities that require alertness until you know how Sudafed affects you. Also, be cautious if you have conditions like diabetes, alcohol dependence, or liver disease, as Sudafed products may contain substances that could affect these conditions. If you are an older adult or if you are pregnant or breastfeeding, it's important to discuss the risks and benefits of using Sudafed with your doctor before taking it. Similarly, if you are a parent considering giving Sudafed to a child, be aware that children may be more sensitive to its effects. Overall, it's important to have a conversation with a healthcare professional before using Sudafed, especially if you have any underlying health conditions or concerns. When taking Sudafed, it's important to be aware of potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking MAO inhibitors, isocarboxazid, linezolid, metaxalone, methylene blue, moclobamide, phenelzine, procarbazine, razagiline, sulfinamide, selegiline, tranylcypromine, during treatment with Sudafed, as it may cause a serious and possibly fatal drug interaction. Most MAO inhibitors should also not be taken for 2 weeks before treatment with Sudafed. Ask your doctor for guidance on when to start or stop taking this medication. Additionally, it's important to check the labels on all your medicines, such as allergy or cough and cold products, as they may contain similar ingredients like decongestants. Ask your pharmacist about using those products safely. If you or someone else has taken too much Sudafed and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include slow or shallow breathing, hallucinations, and seizures. This medication should only be used for a short period of time. Do not use it for more than 7 days without consulting your doctor first. If you forget to take a dose of Sudafed, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take your next dose at the regular time. Don't take a double dose to make up for the missed one. When it comes to storing Sudafed, it's important to follow the specific storage instructions on the product package or ask your pharmacist for guidance. Make sure to keep all medications out of reach of children and pets. When it comes to disposing of Sudafed, it's important to not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it's expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.